Depression. What is it? Do you have it? How do you yeet it? That's what we're talking about on this episode of Mentally Swol.
But first, if you're having thoughts of wanting to kill yourself, close out of this and text SHARE to 741-741.
So, what is depression?
Well, I'm very glad you asked. So, the 5th edition of the Diagnostic and Statistical Manual, as published by the American Psychological Association, determined that the criteria for depression includes...
Hold up. What does all of that mean?
Good question. Let's ask therapist Jess.
Jess, could you explain depression in a way that actually makes sense for all of us?
It would be my pleasure. So the first thing you should know is that depression is a disease. It's more than just being sad.
Really? I thought being depressed just meant that you were really sad.
Well, that's true to some extent, but people with depression find that they feel sad, empty, hopeless, or irritable most of the day, every day, for no apparent reason.
So if someone's salty all the time and they don't know why, they might be depressed?
Possibly. Some other symptoms include little or no interest in activities you used to enjoy.
So, like, if someone used to really like making TikToks or driving around with friends, but now they never even feel like doing anything, they might be depressed?
Yeah, some other symptoms include significant weight loss or gain, and increased or decreased appetite.
So, if someone used to frickin' love going to T-Bell for a double crunch wrap with a Baja Blast slushie, but now that no longer sounds good, they might be depressed?
Possibly. Some other symptoms are not sleeping well, sleeping too much, feeling fatigued or tired nearly every day, and not being able to focus, feeling worthless or guilty, and this is a big one, thoughts about death or wanting to hurt or kill yourself.
Wow, depression does suck.
Yeah, it's awful for anyone who has it. And actually, that's part of the criteria for a diagnosis. It must be clinically significant, meaning that it causes significant impairment or distress. So in other words, it really sucks.
So, who gets depression?
Anyone, really. While there's many different reasons why someone might be depressed, it affects people of all ages and backgrounds. Also, depression is highly associated with anxiety, meaning that if you have one, you're more likely to have the other.
So, what exactly is going on in your brain when you're depressed?
Good question. For that, let's ask Nurse Adam.
Hello, young Padawans. So here's the thing. Your brain controls everything you say, do, or think. As they say, everything psychological is biological. Well, depression stems from chemical imbalances in your brain. But luckily, we have drugs, medications prescribed by a doc called antidepressants to fix it all.
Cool. Any other medical treatments for depression?
Perhaps you've heard of electroconvulsive therapy. Well, you probably have misconceptions of what it is. A long time ago, doctors would shock their patients in a very inhumane way. But nowadays, it's a standard medical procedure. They knock you out and very strategically administer an electrical shock to parts of your brain so that it gives you a brief seizure but doesn't harm you. It's used as a last resort if other treatments aren't working.
So, what else can we do to yeet depression?
Well, the best treatment is a combination of medications and therapy.
Is that everything we should know?
I think that about wraps it up.
If you think you might be suffering from depression, please talk to a professional. Don't self-diagnose. There is hope, and it will get better.
And that's on period, Pooh.
Stay swole.
If you want to keep Mentally Swole free, please visit our Patreon page.